Hi wonderful people, welcome back to my channel and compliment of the season. My name is Midwife Jess and today I'm going to be sharing with you some of the things I wish I knew before I gave birth. Okay, so if you are a first-time mom, if you're expecting very soon, or you're planning to get pregnant soon, please, this video is for you and make sure you watch this video because I'm sure it's going to help you. Okay, so the first thing I wish I knew before I gave birth is that labor isn't always like the movies. You know, in the movie where you see a pregnant woman in labor and you see her come and scream and then scream again, and the next thing you see that she's having her baby on her hand. Oh my dear, labor isn't like that. Especially if you're a first-time mom, please just know that labor takes a long time. Okay, it all depends. If for some women that has given birth so many times, okay, it doesn't take that so much time for some women. Okay, but if you're a first-time mom, just know that it will take some time. And one other thing I want you to know is that you don't have to compare yourself with another woman in the next room, because I see some women in labor they're in their room but their mind and ears are in the other room and trying to know when the next pregnant woman screaming in the next room delivers. No, you don't have to do that. You don't have to put this pressure on yourself. Okay, you have to be kind on yourself. Okay, everybody is different. You don't know the person who is in the next room. Maybe she has been laboring for a long time at home before she came to the hospital. Okay, so please don't compare yourself with anyone once you are in labor. Just relax your mind, use some breathing exercises, have a flexible labor plan. Okay, and be kind to yourself. You can also request for pain relief. You can request for some pain relief if you need them. Okay, and know that your midwife and the doctors are there to ensure that you have a smooth labor and delivery. Okay, fine. Now the next thing I want you to know is that once you're in labor or during pregnancy, you just have to prepare your mind for any emergency. Okay, like I said, especially when you're in labor. Okay, I know that every woman wishes to have a normal vaginal delivery, natural delivery. Yes, everyone prays for that, and that's what I wish for you, if that's what you wish for yourself. Okay, but sometimes things change. Every pregnancy is not the same. Every labor is not the same. If you've been pregnant so many times and you had a normal delivery, the previous ones, does not mean that this current one will be the same. You cannot really tell what will happen and you cannot control it. All you need to do is to be kind with yourself and relax your mind. Okay, and once you're relaxed, the body does its work naturally and brings your baby out. Okay, so please, if you're in labor and a situation came that the doctors came and told you that, oh, something is wrong and right now we have to do an emergency cesarean section to get your baby out quick, please just be kind to yourself. I know how it feels, especially when you've labored for so many hours. Okay, when you've labored and let's say you are 8 cm, 9 cm, and all of a sudden they've come to tell you that, oh, you're going to have cesarean section. I know it's heartbreaking, but be kind to yourself. Okay, the most important thing is that you're healthy and your baby is healthy. And one other thing I want you to know is that cesarean section is not a taboo, just like some women see it to be. There's nothing wrong with cesarean section. It's just another way of delivering, another means of getting your baby out. Okay, so please, if there's an emergency and you see yourself going through cesarean section, please don't take it too hard on yourself. Okay, the next thing I want to talk about is your hospital bag. I've seen a lot of women coming to the hospital when they are in labor with a lot of luggages. Sometimes I ask myself, where are they going with all these luggages? Are they coming for a holiday or vacation? Is it a holiday trip that they are going for? Please, you don't need so much when you're coming to deliver your baby. Okay, you don't need so much things. If you're watching me from Africa, I know in Africa, because I've worked as a midwife, the hospital you register with sometime, I don't know about so many hospitals, but for the hospital I worked in, they give you the list of things you need to buy once you're in labor. You bring it with you. Okay, you just have to buy those things and some other few things like baby things, and then you come with it. Okay, once you're in labor. But if you're watching me and you're in Western country, one of these Western country, for instance, UK, My dear, you don't need so much things because the hospital provide almost everything you need. They'll give you breakfast, they provide your lunch, they'll also provide your supper, as in everything you need. So whatever you're bringing is just an extra, okay? So you don't need so much luggages. And it makes it very difficult when you want to move them from one unit to other. You just have to think about how you pack all those luggages. So please make it very simple. You don't need all those things. I think in my next video, I'm going to be discussing about what you need in your hospital bag, okay? The most essential things you need in your hospital bag, okay? Just to make it very simple for anybody who wants to know about it, especially if you're a new mom, okay? So please make your hospital bag simple, okay? And one other thing I want to discuss about is about clothing. See, when I was pregnant, I was so happy, and I kept on buying things and things and things. And then even with newborn clothes, I bought a lot of newborn clothes. My dear, do you know what happened? My baby was not able to wear some of them because he had grown them very fast. He was able to wear those newborn clothes for about like highest 2 weeks, and then the rest he wasn't fitting into them. So I have to start buying again. So please, if you're a first-time mom, just buy small of the newborn clothes, or if possible, just get 0 to 3 months clothes. With this, they can wear it to about 2 months before they had grown them, okay? So what I'm trying to say is that you don't need to buy so many newborn clothes. You can buy as they grow. As they grow, you buy. As they grow, you buy. Because if you want to buy a lot of them thinking that they're going to wear it for a long time, no, they grow so fast. And that's why it depends on how fast your baby grows. So you want to buy as they grow, okay? Now, also another one I'm going to talk about, okay, it's also about clothing. You want to get zippers and footies for your babies. This is because when they are very tiny, their socks keeps on falling off. You don't want to always pick and wear back again, pick and wear. No. So please get zippers and footies for them. It is the best when they are still very, very young, when they are still very, very small, okay? And also, it's also good for their night wears. They can wear it, it makes them feel so comfortable, okay? Now, the next thing I'm going to talk about is very, very important. Please ensure to take your prenatal vitamins, okay? They are very, very important, especially folic acid. Folic acid prevents neural tube defects on your baby. You don't want this condition on your baby, okay? So please, if you're still watching this video up to this time, I'm telling you today that you need folic acid. Take it every day, okay? And you also need vitamin D and calcium. This helps in the normal development of the bone, okay? Especially if you're in some countries that are very cold during the winter time, you need vitamin D because there's no way you can see the sun. For instance, UK, during the winter time, there's no sun, okay? You can't get the sun, so you need vitamin D, okay? Now, the next thing I'm going to be discussing about is about your baby, okay? Your baby grows, okay? Baby growing is like a phase, okay? For instance, if your baby sleeps normally this week, does not mean that your baby will sleep the same pattern next week. So it's just like a phase, they change, okay? So just prepare your mind for that. They change, and sometimes too they cry. Baby crying is normal. Please don't be so hard on yourself. Babies cry and it's normal, okay? So when they are crying, just remain calm. It's just a normal thing for babies to do. And at a point, their skin will start peeling, or you see some rashes. Please don't freak out when you see such things. It's normal. Sometimes they are all signs that they are growing normally, okay? Fine. Now, one other thing I'm going to discuss about is about your baby nap and wake window. You want to track your baby nap and wake window. This has helped me in a way that, because I know my baby nap times and wake window, it has helped me to prepare my activities around the day, okay? So because I know that my baby is going to sleep around this time and I'm expecting him to wake up around this time, so it helps me to plan my time, all my activities during the day, and it makes things easy for me. And please don't overplan your activities in the day. You know that you're supposed to sleep when your baby is sleeping. So please make time for that too. It's very important. You need that rest, okay? Don't overload your activities in the day, okay? Now the next thing I want you to know, which is very important, is that wherever you go with your baby, make sure I know I get this a lot from women saying that, oh, my baby just pooed right now, I'm just going to be out for about 30 minutes or an hour. So, oh my dear, you can't tell when your baby can poo, and your baby cannot even tell you, Mom, I want to poo right now, because they cannot communicate to you at that stage, okay? So please ensure that wherever you go with baby's diaper and wipes, okay, just to prevent any emergency or embarrassment. And you know, when they poo, they don't feel comfortable until you clean them up and change them. So you don't want them to start crying and crying. And another important thing is that please get a breast pad, okay? Breast pad. This prevents your you know, when you just give birth newly, your breast leaks a lot, especially when baby cries. You see that your breast leaks, okay? So please get breast pad. This prevents your breast milk from staining your clothes, okay? You see people watching that you have these stains on your chest. Please, you don't want this kind of embarrassment. And sometimes breast milk smells, okay? You don't want these things to be staining your clothes and smells. You just want to feel comfortable wherever you are. So please get breast pad, okay? And another thing you need to get is nursing bra, good nursing bras. They are very comfortable, okay? And you can use them comfortably anywhere you go. They make it very easy for you to breastfeed your baby. So please try to get nursing bras for yourself, okay? Now, I'm going to talk about food and pregnancy. When I was pregnant, I ate a lot. And I think it's because of pregnancy hormone, and it's natural for everyone. It makes you eat and eat. And I gained a lot of weight. At a point, I told myself, okay, I'm just going to be eating, not just for myself, for my baby, because my baby needs those nutrients. But I said that once I give birth, I'm going on diets. I want to go back to my previous weight. But do you know the surprising thing? When I gave birth, my dear, I kept eating. I keep feeling hungry and hungry and hungry. It's because of the breastfeeding. So because I'm breastfeeding, it makes me feel so hungry all the time. So I keep eating and eating. My dear, it's normal. In case you feel something like this, don't be hard on yourself. It's normal, okay? So because you're breastfeeding, you need to renew those strengths that is coming out from you, okay? Now, please ask for help anytime you need it, okay? Don't be too hard on yourself. Just ask for help. You can lean on your parents, your family members, your friends. You can lean on anybody you feel like that can help you. Don't be so hard on yourself. I know some women always be like, oh, I've got this, but silently they are dying secretly. Don't do this to yourself. If you know someone who can help you, please don't be shy. Just go and approach the person, and I'm sure they will definitely help you, okay? And then finally, parenthood is a full-time job, my dear. It is a full-time job, okay? So please prepare your mind. Everything I'm saying here is not to scare you. It is to prepare you for what is going to happen, or for what you're going to see. Okay, so please, it's a full-time job. It will take all your time and concentration, okay? Especially if you're a first-time mom. So please prepare your mind for that. And please, after you give birth, take good care of yourself. Take good care of yourself. Take good care of the perineal area where the baby came from, so that you won't get infection, okay? Take good care of yourself very well. Eat good food. Hydrate very well, okay? And sleep. Try to sleep. It will help you relax your mind, okay? Thank you so much for watching this video. And in my next video, I'm going to discuss about the things you need in your hospital bag. The essential things you need in your hospital bag. So please look out for it. And thanks for watching. If you've not subscribed to my channel, please ensure to subscribe, because I know that all the information I'm going to be bringing to you will help you a lot. Okay, we're going to be talking about a lot of things, and we will share a lot of life stories and experiences. Please, you don't want to miss all these things. Please subscribe, okay? Make sure you share, you like, you comment, okay? Okay, dear. Bye-bye, and see you in my next one. Bye.